Okay guys, now I just can't want to continue this thing. So then there is a inflammatory joint disease like infection, gout or rheumatoid arthritis. So these are also conditions that can lead to osteoarthritis, because rheumatoid arthritis is also autoimmune disease that can affect many joints, even whole system, even every system affected by rheumatoid arthritis. Then there is a noisy osteoporosis and obesity, which is strong modifier risk factor. What is the mean modified? That obesity you can reduce, but other thing you cannot reduce. So this is a very important thing in which you will see in every patient. Then there is a occupational required repetitive knee bending. If you repeatedly do knee bending exercise or work, it can lead to osteoarthritis. Then there is a older age, which I already mentioned you. Old age mean that in old age that bone become weak, cartilage become weak, so it eventually lead to osteoarthritis. Then there is a previous knee injury like torn meniscus or intra-articular mechanical damage. Intra-articular mechanical damage means between articulation there is a mechanical damage. So it damage can be anything. So it can lead also risk factor. Then there is a what's the epidemiology. So most affected more than 40 years of age. So that's the thing what I want to tell you here. So for 40 years of age, if anyone is more than 40 years of age, so their joints become weak, their cartilage become weak, so they easily can destroy. Cartilage easily become damage, you can say, when you repeatedly doing any activity, or your occupational like that, you have to work or you have to go here there and up, you are just taking upstairs, you can go up from through upstairs. So this is also thing. Osteoarthritis most commonly affected the hands, lower back, neck and weight bearing joint. What the meaning of weight bearing? It means the joints on which weight is bear, like hip and feet as well. So symptomatic knee osteoarthritis occur in 10% in men and 13% in women over age 60. Now what's the pathogenesis? What's the pathophysiology? Now I'm talking about pathophysiology. So this is a pathophysiology that early changes, destruction of articular cartilage, which split and becomes erode and lead to narrowing of joint space on X-ray. There is inflammation and thickening of joint capsule. So this is an important thing. Now see, spine osteoarthritis affects knee joint as well as vertebral joint. So you can see there is a bone spur, mean where bone protrude outside and there is a narrowing of joint space. When there is inflammation, this is a normal. When there is an inflammation or any bone spurring, you can see in the picture there is a destruction of cartilage. So this can lead to bone spur, or sometimes it can happen that disc or nucleus pulposus protrude backward and it can put pressure on spinal cord, and that eventually lead to neurological problem. Now what's the stages of knee osteoarthritis? So these are the stages. As you can see, in first stage there is a minimum disruption, mean there is already 10% cartilage loss, but you can see there is also little bit space become less. But in the grade 3 you can see joint space narrowing, the cartilage to begin breakdown and occurrence of osteophyte. What's the meaning of osteophyte? It means that the extra bone formation happen, and you can see appreciate on the X-ray. When you appreciate on the X-ray, there's a osteophyte. Then there's a moderate damage, you can see there's a space between less, and when there's a severe form, space become less, there is a redness, inflammation happening the end of the bone, and joint space greatly reduced, and 60% of cartilage is already lost, and large osteophyte. There is a occurrence, mean initial, and there is a large, it means already formed. So this is a thing that you must appreciate. And in my next lecture I will talk about sign and symptom of osteoarthritis. Thank you.